2 feet more, I wouldn't even be here. The blast was huge enough to where it actually rocked me, injured my neck, my cervical area, and my lower back. My name's Michael Daley. I had spinal fusion surgery 6 months ago at Community Medical Center. In 2011, we were deployed to Afghanistan. We were actually on a routine patrol through Zarganshar. I was the third vehicle in when we had a IED explosion go off, and it basically tore apart the whole front end of the vehicle at that time.
When I first met Michael, he presented with severe low back pain and leg pain, and his X-ray and MRI findings showed that he had a slip in his lower lumbar spine. That slip was causing instability in his back that led to a lot of back pain.
For the better part of 11, 12 years, I did pain management, I did epidurals, I did everything I possibly could.
At this point, his pain was so severe that he was unable to kind of function at work as well as he'd like to, affecting his personal life. And so Michael was interested in a surgical option.
Having somebody to actually sit down with you and explain it and just put it as plain as simple, like, hey, this isn't working anymore. We need to look at this avenue. And I really think that this is the way to go for you, and I'm confident that this will work. And he was 100% right.
Typically when you think of spine surgery, you think about approaching it from the back, where your spine is. But where his problem was, there is an option to go through the front. The advantage of going through the front is that you can put a much larger spacer where that disc is degenerative, as opposed to if you went through the back. If we go through the front, though, the caveat is that I need a good vascular surgeon to give me access to the spine through the front. And so that's when Dr. Koleilat, I called him up and I said, can you help me out here?
So as the vascular surgeon, it's my role to create the working space for Dr. Jandhyala and the spine team so that they can access the spine safely and so that they can perform the orthopedic or spinal component without concern that they're going to injure structures nearby. The most important ones that we worry about are the blood vessels.
Surgery went great, everything went well, and then he was in the hospital for a couple days, just recovering, getting some physical therapy.
6 months later, I'm sitting here with no pain down my leg and no pain in my back. I'm actually able to go out and do walks and hang out with my kids without having pain. I like to, tinker with things, and I like to build stuff. So having that ability to be able to do that and sit in one spot for a couple of hours and woodwork or do something outside and not have my back scream is just amazing.
Just happy about his results, and fortunate I get to work with someone like Dr. Koleilat to get those results for someone as cool as Michael, who did so much for our country, and it's a really great feeling to know that he's doing well.